If you have a patient, for example, that is 38 and they are undergoing stimulation, we get 5 or 6 eggs. Well, not necessarily 5 or 6 eggs fertilize. And so if you have someone, for example, that has 6 eggs and 3 of them fertilize, well, then that would be somebody that we typically would do a day 3 transfer, because we feel like that the best place for the embryos to be is inside the uterus. Conversely, if you take someone that's 32 and goes through IVF and has 16 eggs and 14 of them fertilize, and on day 3 they have 8, well, we're not going to transfer 8 embryos, so that person would be pushed to day 5 to allow us to better select the best 2 embryos or the best 1 embryo to place inside their uterus. There are other situations whereby we really have to do a day 5 transfer, and that's certainly for patients that are undergoing PGD, pre-implantation genetic diagnosis, specifically when you're checking for if the embryo has the 46 number of chromosomes. Well, that's really involves a day 5 biopsy. But most of our embryo transfers are day 5 embryo transfers. Certainly we have patients that have a transfer on day 3, but ideally we like to do a day 5 transfer.